Hi team. So this is a nice little 45-minute Pilates session. It's fine for anyone with any injuries. I will be talking you through some ways of managing your injuries with it today, just obviously because there's going to be a wide range of people. If you are pregnant or have got your period today, I'm going to just be giving you some other options as well. That sounds terrible. Okay, let's try it again. Hi, this is a 45 Pilates. Hi, this is a 45-minute Pilates session today. It's appropriate for most injuries. If you are pregnant, however, this session will not be suitable for you. If you are pregnant, let me know and I will put together a class just for you with this Pilates. So the session is all about doing some general whole body strengthening, upper body, core, back, glutes and legs, and gain a little bit of mobility into our main joint. So I hope you enjoy it. Feel free to click on your feedback workout tab and let us know how you find it. So we're going to start off on our backs on the mat, legs bent, feet flat. Okay. So we're just going to make sure that you're nice and comfortable here. Place your hands behind your head, tuck your chin in, and we're just elongating the back of your neck. And yes, as you know, a couple of extra chins. We're just going to relax the shoulders away from the ears. We're thinking about, rather than allowing the shoulders to be tucking up, we're thinking about rolling them down onto the mat. Tuck the ribs down onto the floor. You want to imagine that they're rooting down into the mat. We're going to place our hands gently on the ribs, either on the sides or at the top. And we're going to focus on our Pilates breath. So we're going to inhale in through the nose. Feel the ribs expand wide into your hands and exhale like you're blowing out through a straw out your mouth. Feel the ribs come back and in. So it's a lateral movement. The ribs are going to come open and they're going to come close. It is a hard breath to get used to, especially if you're used to more of a belly breath from your yoga. Very good. We're going to keep breathing here. Just getting that breath set up. So whenever I talk about breathing in this session, this is the breath that I'm referring to. It's this really nice lateral breath. You want to be feeling the space occurring all the way in between each rib, feeling the connective tissue and the muscles expanding and mobilizing. So it's a full breath, allowing the lungs to fill completely. And then really taking the time on your exhalation to let go of all of the air within you. This is also going to give you a little bit more time to be in the challenging part of a pose, which is obviously what you're seeking, I'm sure. When we think about our core, I want you to put your hands into a triangle shape. You place it on your belly button with your fingertips down towards your pubic bone. We're thinking about bringing the sides of our hips, those huggy in core muscles, draw those in, those corners of your triangle. And we're thinking about shortening the space between our pubic bone and belly button. So those muscles there are just going to come in towards one another. It's about a gentle hold. So you're thinking about the same amount of tension as you'll hold onto a warm cup of tea. Nothing too hard. We don't want to squeeze and crush everything. Okay. So that nice, gentle triangle just to bring that sense of core. Some people imagine it's the idea of zipping up a tight pair of jeans after you pop them in the dryer. We're going to start by finding our hip position. So place your hands on the front and the backs of your hips. We're going to tilt down through your pelvis. So we're printing or imprinting the lower back to the floor. You can keep your bottom on the mat. And then we're going to roll your hips forwards, just increasing the arch through your lower back. So we're just going to start with this movement here. Be mindful of where the movement's coming from. It's very easy to push through your heels here. So we want to take the weight off your feet where possible, keep them nice and light. And we're working in through the triangle, in through the core, and keeping the buttocks pretty soft here. You want to move in a range of movement that's comfortable for your back. You don't want to be making it feel uncomfortable. Okay, we're going to start to find our setup here. So for those of you with a sore lower back, or you're feeling kind of a bit weak or fatigued at the moment, make sure that you have a tilt, which is what we call a posterior tilt. Your lower back will be flat to the floor. For those of you that are more comfortable and confident with your backs, we're going to tilt our hips to what we call a neutral position. So your fingertips are in line. The pointy parts are in the same line, and you'll have about a hand width between your lower back and the floor. Okay, so nice and strong through core, shoulders relaxed, nice long neck. Okay, from here, we're going to start really simply with our leg raise. So keeping the core engaged on your breath out. We're going to lift one leg up off the floor, floating it up to where the knee is in line with the hip, floating it back down, alternate the legs. Now, this is also a really nice opportunity to put some awareness into your hips. We want to make sure that they're not wiggling and woggling. So since this is a pre-recording, unless you've got one of the members of your family or friends making sure they're keeping an eye on you, it can be easy to not notice. So use your wee teacher friends, which is your fingertips, and keep those on your hips. As you know, when we're in class, even the online classes, that I would be nagging you about those hips. So try and keep them as stable as possible. Keep bringing attention into that triangle. So we're inhaling to lower, exhaling to rise. Now, we don't want any catch occurring in the front of the hip here. So if you're noticing that, just take a pause, rub out the hip, bring attention to the core again, and put a little bit less effort in as a secret wee trick. In Pilates, we're only wanting to be working about 20% effort. Very good. Okay, so we're building up today. So this is a layered practice. It's so that you can do it at home and feel comfortable and safe. From here, we're going to go into what we call a leg extension. So we're going to stretch out one leg and you're going to stretch the opposite arm away from you. And then we're going to bring it in and we're going to stretch out the opposite side. So we're alternating. We're trying to keep fluidity to our movement. Nice, smooth transition. So some key points here is, again, making sure that our hips stay nice and balanced. Our ribs stay drawn down to the mat. And I want you to start to bring some attention to the shoulder. Quite often we'll hitch our shoulder to lift the arm up. What we're trying to do is keep that shoulder tucked down, like it's tucking down towards your mid-back and moving arm. Often what we get stuck on as a student is our ego takes over and we're trying to go as far as we can and we end up arching. What we're trying to achieve here is a sense of stability. So your hips, your ribs, the back of your shoulders are rooted down into the ground. And we're just allowing bones to move in the joint rather than hitching the joint itself to create the movement. That just allows a little bit of extra mobility, much better stability. Awesome work. We're going to do one more other side, breathing out to extend, breathing in to return, and the other side. And it shouldn't be feeling hard, okay? If you're hardly feeling anything, you're doing it right, okay? Arms down on the floor. We're going to stretch our fingertips towards our heels. Make sure your legs are comfortable here. I want you to really connect the upper arms into the mat. That's going to give you a wee press, and it's just going to keep you really secure and tone the back of your arms at the same time. Come back to our lower back imprint or our pubic imprint. So we're tucking down through our tailbone. We're going to scoop through the pelvic floor and our core, and we're going to peel up our spine into a bridge, one bone at a time. Seeing if you can bring the chest to the chin, and then we're going to slowly peel down through the spine. Now with this exercise, they are contradictory breathing between yoga and Pilates. My biggest recommendation is just keep breathing, okay? Rather than trying to strive for perfection here, what we're looking for is just looking for progress. So key points are thinking about where you're noticing the muscles lift. People can put pressure anywhere that they want to. We're generally trying to get a little bit of glute activation, nice strong pubic pelvic floor, and into the core. We're looking for this idea of lifting each bone up one at a time, like they're in a chain. So we're trying to see the fluidity of the movement. We're looking to make sure that there's no catch in the lower back. So if you're noticing a catch occur, two things that you can do. Engage the muscles where your glutes and your back of thighs meet. That's going to help tilt the pelvis so it gives you more space in your lower back. And another trick is just don't go as high, okay? You do not have to push the movement here. So normally in Pilates, we're exhaling to lift, inhaling to lower. And we've just got two more. Keep noticing the shoulders. It's easy for the shoulders to come up towards your ears. Keep them tucked down. And for anyone that's finding any knee pain here, try sliding the heels out a little bit further from your buttocks and widening the knees, okay? Using a glute activation will often take the pressure off your knees. Well done. Awesome work. We're going to take our feet wide on the mat now. Feet still flat, arms are going to come wide. If you have sore shoulders, keep your hands kind of on a 45-degree angle. If you're comfortable, come into a 90-degree angle, so right angle at your armpit, or if you're feeling really flexible and mobile in the shoulders today, bring those arms up into goalposts. From here, we're going to roll our legs to one side, turn and look to the opposite direction. We're going to inhale at the base of the movement. So I want you to feel your ribs expand, and you may want to push slightly forwards into the hip. Make sure you don't catch into the lower back, and that's going to give you a wee stretch in the front of the thigh. As you exhale, we're going to tuck down through your ribs so you maintain the length of your lower back. So we're focusing on the rib weirdly, not the hip. And then continuing the exhale, we're going to roll our legs down to the other side. Inhale, expanding into the rib. And then on your exhale, returning that movement back. So some things to think about with technique. We're looking at getting the back of your thumb, pressing that into the mat. That's often going to give you a nice, comfortable shoulder. However, there will be 2 or 3 of you that doesn't work. Feel free to turn your palms down if that's not serving you. Okay, so it's all about finding the way to make something work for you. Sometimes we get a sore knee on the top knee as it's coming down. That's because the top knee can sometimes drop. Try and maintain the height of the top knee and press forwards with the hip. Sometimes that can catch in your lower back. So what you're wanting to think about is rather than that lower back catching, we're going to tuck down through the tailbone so you maintain the length of your lower back. Well done. We're going to do one more either side, taking our time. This is a really nice space creator for the front line of the body, anywhere from your knees to the top of your head. Beautiful work. All right, we're going to come back into center. We're going to repeat those 4 moves. I'm going to add a little bit of more complexity. If you're already finding it hard enough before, or it was just at the right level, you stay at that level. I'll give you that first option, and then I'm going to layer it up today. So again, let's just think of our Pilates set, tucking in through the chin. You want to feel a couple of chinnies, tuck down through the shoulders, ribs down, into the triangle, breathing with the ribs, having that comfortable pelvic position. It's not going to shift here, and we're going to slowly exhale as we lift one leg up off the floor, bringing the second leg up if you're available, and then we're going to bring the leg down one at a time. So we're going to alternate which leg lifts up, using the full exhalation to lift the legs and the full inhale to lower the legs down. Some ways to know if it's a little bit too hard is that puku is going to pop up to the sky. That means your core's not quite strong enough to lift the weight of your legs just yet. So we want to keep that core engaged. You're better to work at a lower level, be safe, do it with quality, then push at a higher level and cause yourself issues, because you can damage your pelvic floor muscles here. You can put pressure on the back and the hips if you do this incorrectly. There should be no catching in the hips. If you're catching in the hips, it's a sign that your core's not firing. So just take a pause, reset your core. Sometimes you've got to rub those muscles just to switch them off, tell them that they're not needed. Even roll them out with your thumbs as you're floating up. And the last one is sometimes people feel it in their back. That's again a sign that you might have arched into your hips or that your core isn't quite strong enough. So just come back to your single leg. We're going to do one more of the doubles. Very good. And then we're going to stay up, and this is the position that we call tabletop. Okay, so this is where your knee is in line with your hip. It doesn't come forwards, because if it comes forwards, it's no longer a core exercise. And we want to have those feet in line with the hips. We're going to extend one arm and the opposite leg again, still maintaining the balance through the ribs, through the shoulders, and through the hips. The core's still staying in, it's not popping up. If it's too hard, come back to your single leg extension. Exhale to lengthen, inhale to return. Okay, so you've got your 2 options here. Lots of people ask, what should I do with my feet? If you want to be engaging the back line of the body, so that's your calves and your back of thighs, point your toes. It's also good if you're, say, a swimmer or a diver or a dancer. For those of you that want to be stabilizing your knees, for example, bring those toes up. It's going to switch on your quads. Just be careful if you tend to catch into the front of the hip, because that's going to encourage that to happen. It's going to switch on the front of your hips. Okay, we're going to do one more either side. Beautiful work. Nice strong core. Should be no clicking in that hip, by the way. Coming back and in, bringing our feet down, feet flat to the mat. Moving into our bridges. So tucking down, pressing into the backs of the arms, tucking down through the tailbone. For those of you that would like to add challenge, bring the arms up and behind your head as you go. It's going to destabilize your body, and then we're going to very slowly peel down. Again, we're looking for a nice long line of lifting. We don't want to see it like a wiggly old chain rolling on the way up, okay? Just keep checking in with your body. It should be feeling like it's holding a little bit of activation at the moment, but it shouldn't feel like it's super hard right now. Use your breath here as we're floating up and we're floating down. And again, if you are having any questions, you are more than welcome. Just to avoid this exercise for the moment, please, please, please feedback, because we want to make sure that we can support you with learning how to do these poses safely for your body. Well done, you're doing awesome. We've got 3 to go. Really trying to elongate the spine on the way down. Finding this really smooth movement. Well done. We've got 2 to go. Using your breath, checking in with your core. It's the beauty of Pilates. You can't think of anything else. We've got 1 more to go. You're doing awesome. Peeling ourselves down. Well done. Okay, from here, we're going to come into our supine twists or our oblique work. So we're looking at starting to engage the muscle that lies from essentially from your side down into your pubic bone. So you can feel that on the inside of your hip bones. You're going to feel that muscle engage and kind of be strong against your fingers. So from here, our legs are going to be together. Some people like to have them touching. Feel free to do that. You've got 2 options. You can have your back pressed down with those legs bent, or if you'd like a little bit more challenge today, you can keep those legs up off the floor. We'll start nice and easy, shall we? So back to your wide arms, either 45, 90, or at your goalposts. Roll your legs to one side, turn and look to the opposite direction, rolling the rib down to the floor. Scoop into the muscle we just talked about. Feel that muscle hug in, and you're using that core, using your tummy, that beautiful powerhouse to bring those legs in. If you'd like to pause at the base of the movement to inhale, that's going to give you a beautiful space creation through the side and the back, and then bring those legs back and in. Okay, so we're rolling down, turning your head as far as it feels comfortable, strong core, turning back into center. Nice and long, keeping it strong. Easy breath here. Keep checking in with the shoulders. Finding that beautiful space. Try not to force the movement. You're only moving to where you feel comfortable today. We're not here to impress anyone. We're here to do you. Awesome work. Nice and strong through the core. Let's do 1 more either side as you feel comfortable. Into our round 3. How good. Let's come back. Let's hug those knees into your chest. Reset your spine. A lot of the work we have been doing is creating length through your back, opening up your chest and your shoulders. So it's going to give you that little bit more space. Alrighties, into our leg lifts. So neck, shoulders, ribs, breath, core, pelvic tilt, floating either a single leg or a single to double. Or for those of you that are really loving it, let's float up our double leg lift. Keeping the legs bent today. Don't worry, we're going to build up on this over the next few weeks. It's just really nice to have a good foundational class to start off with, where we get really familiar with these really common exercises that you might see in a class. Well done, using your breath. Exhale to lift. Inhale to lower. Doing great. We've just got 4 to go. And 3. And 2. Keep checking with your back and your core. And 1. Well done. Alrighty, leg extensions. So we started with our foot on the floor, extending our arm and leg. We were considering the length of our body. Then we started it in tabletop. For those of you wanting a little bit more challenge, you can go to a double arm and leg extension now, scooping into the core. Make sure you're only returning to your 90 degrees and that their back and your pelvis is staying stable. We don't want it rocking all around the place. Exhaling to stretch out, inhaling to return. We've got 3 to go. 3 and 2 and 1. Beautiful work. Bring it in. Let's place his feet on the floor into our bridges. So we can go to our basic bridge. Nothing moving, pressing the upper arms into the floor. Or you can start to lift the arms. Beautiful for your shoulder release. Starts to unbalance the body. For those of us that are wanting to work a little bit harder into our glutes today, we're going to float up into our bridge. Pause at the top. Make sure that you're holding a nice strong line. So you're lifting from your glutes. Float one leg up off the floor. Bring the leg back and down. And then we're going to peel back down to the floor. So things to really be in mind of. I don't want you lifting your leg and doing the lift and lower today. We want to just make sure we've got that nice strong stability. So we're only lifting the leg at the top of the movement. Make sure that you alternate your leg as you're lifting. So we're lifting one leg one side, the other leg on the other side. If there's any pain in your lower back, hip, or even in your brain, let's just come back to an easier option. We're all about quality here today. Nice and strong. We're just going to do one more either side of our leg lifts, or 2 more of your normal bridge. Well done. Coming on down. Now this next exercise is not appropriate if you have a hip replacement. It can dislocate them. Some people can, but let's just be careful today. If you've got a hip replacement, come back to this one with our legs wide or the double legs together. So we're going to lift our leg up, making sure our hips stay stable. Place your ankle on top of your thigh, creating a figure of 4. Okay. If this is uncomfortable for you, again, go back to the other options. We're going to slowly roll our legs to the side, turning our head to the opposite direction. And scooping through core, rolling back through rib, coming back into center. Okay, because this is quite a complex rotation that's happening around ankle, knee, and hip. So you do want to make sure you're comfortable. You don't want any catching happening in your hip. So if you can't adjust it to where you feel comfortable in the hip, just come to this nice open leg. It's obviously what those hips are needing. Okay, I've got 2 more on this side. Sorry, we're having a few headset issues. Well done. Nice big turn. Hoping those shoulders and chest muscles are starting to wake up a little bit. Good. And then we're going to swap over our legs now. In a perfect world, those hips are going to stay super stable. They're not going to hitch or twist or rotate. Then we're just going to roll those legs, tuning our head to the opposite direction. Strong core. Tuning our head to the other side. Wonderful work. Easy breath here. Well done, team. Last one either side. Nice and easy. Coming back into center. Well done. Bringing the legs down. We're going to roll to the side. I'm going to add in your next movie when we're going to be doing our back work. But this is just a nice 20-minute session just to get you started. Thank you very much.